Instrumental use. Now, instrumental use is starting to get, now you're starting to get into that kind of that, what I call the one foot on the banana peel, the other one in the grave. You're in the slippery slope here, because instrumental use is now you're using it for a purpose that's besides just socializing. The alcohol or the drugs are providing something that you don't typically have, okay, or not getting enough of. So it's kind of almost in a way seeking pleasure but avoiding pain, so you get both. Unfortunately, sometimes in the pursuit of seeking pleasure, you get pain, but then you drink again and you forget about the pain. It kind of goes around in circles. So pleasure seeking, fun, power, and control. Exploring new states and perceptions is a common way. The social lubricant, it reduces inhibitions. All of a sudden, you think, you know what? You're Brad Pitt. I can talk to anybody. Never mind you're spitting all over the poor girl's face and drooling and not making any sense, but you think you're really good. Okay, so that's the social lubricant. And if you don't believe me, go to a party where everybody else is drunk and you're sober. It's an eye-opening experience. The other one is avoiding pain, and this could be psychological, physical pain, but typically psychological pain. And it may reduce anger, guilt, shame, grief, boredom, anxiety, or whatever other feelings you have. Now, the dangers of this is that significant problems may begin to arise, because you are getting this reinforcing pleasure. You want to continue using it. Okay? So now you start getting into habitual use. Sorry.
Do you know it's the 15-minute mark, so it's 1:30.
Oh, okay. We have 50 more minutes?
Yeah, technically.
We're not even near it.
Or longer, if something.
I said, if you guys can stay longer, I can go. So, habitual use, suffice to say, this is when serious problems are happening in one or more areas of your life. Remember I told you about the relationship. You start seeing these problems. Other people start seeing these problems. I've had kids that have come in as my drug dealer says, I have a problem. Okay, when your drug dealer tells you you have a problem, it's time to see somebody. Okay? Now, almost all friends will be users. The ones that aren't either kind of go by the wayside and leave you be, or you let them alone. And all social functions involve using. Compulsive use. Now we talk about like what we consider dependence or addiction. Okay, there's the overwhelming physical and or psychological need to use, and we talked about tolerance and withdrawal. This is when it starts kicking in. Okay. And then what I call university use, binge use. So doing what you have to do for a week, but getting wasted Friday and Saturday, recovering on Sunday, being able to go to school on Monday and Tuesday, okay? So binge use, in a way, it's not as continuous, but it's sporadic, but it's a lot more doses, a lot higher dosages. So it can be as problematic as regular use. The problem with binge use is that it's often associated with higher levels of problems at work. So not showing up for work, or even school, not getting that, not getting that paper done, not being able to get that paper done. Go downtown on a Saturday night, you'll notice the hostility and aggression. Okay? Higher arrest, higher levels of domestic violence, and higher hospital admissions because people aren't sure how much they can take. I remember when I was going here and I was in my undergrad, Gage, they still have Gage towns? That's first year students. There were people falling downstairs, and there was ambulances every Friday and Saturday night because all of a sudden you get these 18 or 19-year-old kids not at home anymore. All of a sudden they can drink as much as they can, but they don't know how much they can handle. And it was causing a lot of issues. So, a formula for addiction. An enabling environment, vulnerable person with all those risk factors we were talking about, access to drugs, can, repeat after me, can, not will, can lead to dependency or addiction. Okay? In a way, an addiction is almost like a perfect storm of risk factors coming together. Not one risk factor will cause addiction. Not all risk factors will cause addiction. But having said that, one risk factor can cause addiction and vice versa. So it's individual. So, drugs and their effects. Like I said, I'm not going to go, this will just be a little quick, just to give you a little idea of what they look like and what some of the slang terms they use are. So, first of all, routes of consumption. Inhaling, injecting, snorting, and swallowing. Which is the most addictive way of doing it? Who agrees with injecting? Yeah, close. Second. Inhaling is the most addictive. Think about if you ever tried to quit smoking. The reason being, it's actually physiological. When you inhale, it goes directly to the brain. When you inject, it has to go through the arterial system. It takes longer to get to the brain. Okay, and this is in order of addictive potential. Okay, swallowing makes sense because it's got to go down the stomach, it's got to be absorbed, and go to the brain. Now, mind you, sometimes this could take a few seconds to a few minutes, 10, 15 minutes, especially with alcohol. So, stimulants. Stimulants, think of it this way. Stimulants are up, depressants are down, hallucinogens are all arounders. Okay? So up, down, all arounders. Stimulants, the most common ones are cocaine, some of the street terms, coke, snow, flake, blow. Nobody uses snow unless it's in the 1970s. Flake, not very common. Blow is the most common term. Coke, too. Drug dealers call it up. Okay? Crack. Crack. Sometimes it'll just be called crack. Crack cocaine, as I joke, if anybody asks you for crack cocaine, it's the cops. Nobody calls it crack cocaine. It's almost redundant, actually. And rock is really common. All crack is cocaine dissolved in water and baking soda. And you get the name because when you heat it up, it crackles and it forms, I'll show you the picture, it forms a kind of a dirty looking little rock. The effects are similar to those cocaine, but amongst drug users, there's a hierarchy. Drug users look down on other drug users. Cocaine users look down on crackheads.
What's more expensive?
Cocaine. Cocaine, anywhere from $60 to $80 a gram. Crack, you can get a $10 rock or a $20 rock, depending on availability. Cocaine is seen as a lot more socially accepted, a lot more high-end than crack. Okay? Methamphetamine, typically known as jib or meth, we're talking crystal meth here now. That's cocaine. Now that's a lot of cocaine. Okay? That looks like about $4 or $5. Now that's almost like $300, $400 worth of cocaine there. Okay? It's not that much, but it's very expensive. That's very clean crack. Typically it's nowhere near that clean. It's spotted with impurities and such. Remember, any drug that an addict will buy, if they're lucky, 30% pure drug. The rest of it is filler. Okay? Cocaine thrown in like baking soda or whatever. That is a crack pipe. And these are basically pipette tubes that you can get anywhere, because you can get them in tobacco stores. A little Brillo pad, they put the rock there, they light it, inhale. That is crystal meth. Not to scale. Okay? It's very, very small, but it's crystalline. It's a crystalline form, and it looks like that color. It's pretty dirty. Now, crystal meth, of all the drugs, is probably the dirtiest drug in terms of the impurities that are in it. As I said, when I was working in the custody center, a lot of the kids that used to make the crystal meth for the Hells Angels and the gangs would be in there. I wouldn't trust these guys to make me toast, much less my drugs. So quality control is all over the place when it comes to this sort of drug use. That's very, very clean meth. It's never that clean. Now, the other thing is you also got to remember is a lot of the drugs, they add things to make it look cleaner. Like cocaine, like heroin itself is brown, but they add a lot of white stuff to make it look more sellable. That is a crystal meth pipe. And it's basically a test tube that's blown, like Murano glass from Venice. You just go, blow, and it forms a hole, and you plug a little hole in there. Now, I want you to use your imagination. I used to draw this for people, and so you can imagine long, whole thing. Right. People would, yeah. So I had to actually get the picture. And the other thing is too is that the problem is that I always kind of, and I won't be talking about this today, but this sometimes can trigger addicts. So whenever I have a group from the public, I always say, look, I have pictures. If it's going to trigger you, turn away. But having said that, if I've been spending an hour talking about drugs, that's probably going to trigger you too. So, but anyways, same thing, Brillo pad. The meth is in there, light it, smoke. So these are some of the kind of the side effects of the stimulants. Okay. You could read this. I'm not going to go. I'll go through the more important ones. For stimulants, one of the more, two of the more kind of common but dangerous side effects is that there's a study that says that almost the vast majority of any heart attack under the age of 30 is caused by stimulant drugs. Okay, And then there's the chance of psychosis, which is that break from reality. So you can have a psychotic episode, especially with crystal meth. Okay, so there's paranoia, mood disturbances, delusions, and hallucinations. People that are taking meth and that are coming down from it will truly believe that there's a little black shadow following them. They can see a black shadow following them. They'll freak out that there's cops in there. Right? One of the more nasty ones that usually typically comes with crack cocaine is called delusional parasitosis. And it's a really, really very strong belief that there's bugs crawling under your skin. And they will actually pick away at their flesh until they reach. I've seen scars, you can see the bone. They'll pick away because they think there's bugs crawling under their skin. Okay? Depressants. Depressants produce a feeling of calm, they dull physical pain. Okay? And there's two types. There's the opiates, the narcotic analgesics, which are opium, codeine, morphine, heroin. Codeine, morphine, heroin, same thing. Okay? There's only a slight chemical difference, but they're more or less the same thing. Then there's the sedative hypnotics, which are alcohol, barbiturates, anti-anxiety medication, and GHB. Okay? And as you would expect, the use of depressants will lower heart rate, slow reflexes, impair vision, numb emotions. Out of all the depressants, which do you think does the most damage? Alcohol, by far. By all, it dwarfs all other drugs. Right? I was just reading a little article, and they were trying to make it. They were trying to quantify it in terms of, like, let's say out of $1,000, they just used it kind of. I don't know how they did it. If in terms of damage to monetary, physical, legal, street drugs maybe cause about $200, whereas alcohol $998.
But is that due to the toxicity of alcohol or just the prevalence of alcohol? Like if we're just comparing
both.
The drug itself, or is it because of its prevalence in society?
No, the drug itself. The drug actually causes a lot more physical harm, physiological harm, which is the most benign drug.
Pot.
No. That doesn't do anything really to your body.
Heroin?
Heroin. Heroin is the most benign drug that you can take, but it's got that, oh my God, heroin. It's a lifestyle that screws you up. But alcohol actually literally it affects your liver, your brain, a lot more of the system.
Crazy that it's...
Well, yeah, that's like I said, that's a 3-hour conversation. Okay? So the problem with alcohol is that at higher doses you can inhibit vital functions of your autonomic nervous system, which is the part that controls things that you really shouldn't be having to control, i.e. your breathing and your gag reflex. So this is the rock and roll death, swallowing your own vomit. Okay? You take enough alcohol, you inhibit the autonomic nervous system, you no longer have a gag reflex. You pass out, you vomit, it goes into your lungs, you literally drown on your vomit. GHB, it's actually becoming really common, and it's kind of like, it's the date rape drug. So it's kind of like roofies, and it was originally a sleep aid, and people put it in other people's drinks to kind of make them pass out, and it's colorless, odorless, and people prefer it to alcohol because it doesn't have as bad of side effects as alcohol in terms of the next day. But one of the problems with taking too much of this is you get sleepy, sometimes vomiting, muscle spasm, loss of consciousness. It's called G-holding. You just kind of basically passed out there. And the danger is when you mix it with alcohol and depressant, it's extremely dangerous. Respiratory failure. That's what G looks like. It can be in liquid form, powder form. Heroin. Typical down is what it's usually called, or heroin. Nobody calls it horse. It's derived from morphine. And some of the long-term effects are increased chance of getting HIV or AIDS if you're sharing needles. Skin infection is very common. Collapsed veins. Collapsed veins are not like what you see in the movies. It's not like these big black track marks all over you. It's more like little scratches. Little scratches on your legs. And it's basically what, think of this as if you have an inner tube and you keep on plugging the inner tube, it no longer inflates. Same with the drug.